At 83 years old, lady admitted from nursing home with infected lower leg ulcer. He underwent an attempted long superficial femoral artery subintimal angioplasty 2 weeks previously. This demonstrated poor run of below the knee. Poor run of below the knee. What is the best course of action? Here the options. Options are below knee amputation. Below knee amputation with Burgess flap. Below knee amputation with ischial flaps. Transfemoral amputation, Geeky stroke amputation, and wound debridement. So what would be the management? And here the clinical scenario again, there is the infected lower leg ulcer, and in case of the angioplasty, that shows poor run of below knee. That means the below knee area there is very minimal blood supply. So first of all, see, this is a procedure of subintimal angioplasty. Here we know that the blood vessel layers are tunica adventitia, tunica media, and tunica intima. Subintimal angioplasty, that means the catheter, it goes, it pierces the intima and goes between the intima and media, then again pierces the intima and comes to the lumen. So it is technically relatively difficult procedure, but it was done in this patient. And 2 weeks after this subintimal angioplasty, there shows that the leg, they are very minimum blood supply. So here we can see the blood supply or arterial tree in the lower limb from the aorta, iliac artery, common iliac, external iliac, then femoral artery, then superficial femoral artery, finally goes in the leg, and there are divided into anterior tibial artery, posterior tibial artery, and also peroneal artery. So anterior tibial artery, posterior tibial artery, and the peroneal artery, they supplies the leg and the foot. But in this patient, the below knee blood supply, that means anterior tibial artery, posterior tibial artery, peroneal artery, they have very minimum supply to the leg for meeting of the metabolic activity. For this condition, actually for this patient, this leg and foot is not salvageable. That means it will be very difficult to save the lower limb. So what we should do for this patient, and at the same time there is a non-healing ulcer present in the leg. So what we should do in this position, there is no role of angioplasty. So here we can see the best option here for the early amputation. Here we can see the early amputation, and what level. Here there is the obstruction, or there is stenosis, or there is the atherosclerosis in the superficial femoral artery. So we should amputate this area proximal to the superficial femoral artery. That means it is the upper part in the thigh. So it will palliate the patient. Early amputation will palliate the patient, and above knee surgery would be better in this condition because there is the obstruction in the superficial femoral artery, and below knee amputation would probably fail. That means when the below knee amputation done in this condition, there may need another amputation in the mid thigh. So first we should go straight forward in the mid thigh amputation. Now see, before any type of angioplasty, the vein mapping is the first to see there is suitable vein preferred conduit. Subintimal hyperplasia occurs in case of early PTFE used for distal anastomosis and will lead to early graft occlusion and failure. Actually, these are not required for this patient, so avoid this. So what we can do, 83 years old lady, infected lower leg ulcer, and also there was the intimal angioplasty 2 weeks previously done, but there is poor run of, that means there is very minimum amount of blood supply in the leg area. So there there is no role of angioplasty, or there is no role of using other prosthesis or angioplasty agents such as the Dacron or PTFE. So in this condition we should go for transfemoral amputation. Other options here such as the wound debridement. In case of wound debridement, it will fail. Why wound debridement fail? Because there is poor blood supply. So in case of the poor blood supply, healing will be very late and healing will fail. So for this condition, wound debridement is not possible. So we should go for the transfemoral amputation.